Distinguished guests, colleagues, ladies and gentlemen, welcome to the FIP series on transforming vaccination globally and regionally. Thank you to all of you joining us live and to those listening afterwards. My name is Sabiha Isak. I am the South African Research Chair in Antibiotic Resistance and One Health and a professor in pharmaceutical sciences at the University of KwaZulu-Natal. I'm also the chairperson of the Global Respiratory Infection Partnership, or GRIP, senior implementation research advisor to the International Center for AMR Solutions, and an expert consultant on antimicrobial resistance and antimicrobial stewardship to the World Health Organization. It is a pleasure to serve as moderator for this session, and I'm privileged to share this platform with an eminent panel of pharmacists who are experts in AMR. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, pharmaceutical sciences, and education. We are very pleased to be delivering this event entitled Pharmacist, Vaccinations, and Antimicrobial Stewardship for the FIP Developmental Goal 17 on antimicrobial stewardship. Next, Farah. The next slide, thank you. So some housekeeping announcements first. This webinar is being recorded and live streamed via Facebook. The recording will be freely available on our website on www.fip.org. You may ask questions using the Q&A box at the bottom of your screens. You are really very welcome to provide feedback to webinars at fip.org, and please, we urge you to become a member of FIP on our website, the address for which appears on this slide. The next slide, please, Farah. Transforming vaccination regionally and globally is the first FIP transformation outcome-based online program of its kind, underpinned by the FIP developmental goals. The final outcome of the program is a historic global FIP commitment to action on vaccination in pharmacy and a FIP transforming vaccination collection, which will be out in 2021. Next slide. This series began in September and will run through into December. The Series 1 events focus on identifying the needs of the pharmacist and pharmaceutical scientist workforce to deliver on vaccination transformation. Series 2, of which this is one of the sessions, will discuss the actions required to deliver on the needs identified in Series 1, aligned to the FIP developmental goals. And finally, Series 3 will focus on FIP member organizations across 6 regions and how they have addressed or will address these actions to deliver on the commitment to transform vaccines globally and regionally. Next, please. We urge you to engage with us. Next slide, please, Farah. Thank you. We urge you to engage with us and help us answer these questions. Please type your answers in the chat box and answer these questions. So in your opinion, what single factor should be prioritized to transform pharmacy vaccination services globally and regionally? What would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? And what else should the FIP commitment to action outline? In today's session, Pharmacist, Vaccinators, and Antimicrobial Stewardship, we focus on the FIP Developmental Goal 17, Antimicrobial Stewardship from the perspective of vaccination by pharmacists. The role of vaccination in antimicrobial stewardship, preserving antimicrobial effectiveness, preventing antimicrobial resistance, and the promise of addressing these issues that pharmacists as vaccination will deliver. Among many others, our main outcome for today is to understand the impact of the FIP Development Goal 17, antimicrobial stewardship, in the transformation of vaccinations globally and regionally. Next slide, please. So vaccination is key to the success of the Global Action Plan on Antimicrobial Resistance, as well as the FIP policy statement on AMR, which is based on the Global Action Plan. The Global Action Plan consists of 5 strategic objectives, and they are listed here. The first is to improve awareness and understanding of antimicrobial resistance. The second, to strengthen knowledge through surveillance and research. The third, to reduce the incidence of infection through prevention and control. The fourth, to optimize the responsible use of antimicrobials. And the fifth, to ensure sustainable investment through research and development. Strategic Objective 3 speaks to reducing infections. No infections means no antimicrobials are needed, and a reduction in the use would subsequently lessen the selection pressure for the development and escalation of AMR, and less AMR means lives saved. The Antimicrobial Resistance Coalition, Fighter Coalition, ran a webinar series on AMR in the light of COVID, Prevention is Stronger Than Cure, which focused on the importance of preventing infections before they start. Building on the infection prevention measures to contain COVID-19, the webinar highlighted that vaccines can play a role in addressing AMR in 2 key ways. Firstly, reducing the incidence of infections due to bacterial pathogens, including the resistant ones, and secondly, by reducing the needs of antibiotic use overall. This indirect effect on AMR by reducing antimicrobial usage and therefore selection pressure on pathogens was also highlighted in a recent report by the Wellcome Trust and the Boston Consulting Group on vaccines to tackle drug-resistant infections, an evaluation of R&D opportunities. The report states that both Haemophilus influenza B and strep pneumonia vaccines have resulted in a dramatic reduction in the disease burden and have been associated with decreased incidence of resistant strains. Evidence shows that universal coverage with the 13-valent strep pneumonia vaccine could avoid 11.4 million days of antibiotic use per year in children under 5. Vaccines also offer long-term sustainable approach to infection prevention because we haven't really seen resistance to vaccines being developed in any of the vaccines that are currently in use. And some of them, such as the diphtheria and the pertussis vaccines, have been around for more than 70 years. The October Research Roundup on Nature also focused on AMR. In a piece entitled Vaccination Curbs Resistance, the authors showed that high vaccination rates can limit inappropriate antimicrobial use that leads to resistance. In an analysis of prescriptions in the US, the team found that higher rates of influenza vaccination correlated with less antibiotic use. For every 10% increase in flu vaccination, there was a 6.5% fall in antibiotic prescriptions. So vaccination is thus key to the third strategic objective of the Global Action Plan on AMR and indirectly contributes to stewardship, as will be described by our eminent panel of experts. Just to say that we will allow each of the speakers to make the presentations and hold a panel discussion in the end. You are welcome to type up your questions in the chat box or the Q&A box, and our speakers will attempt to answer as many as possible online. A few of the key questions will be taken at the end. So it is my great pleasure to introduce our very first speaker, who is Alfonso Pereira. Alfonso is a pharmacy graduate and holds a PharmD and a master's in pharmaceutical care from the University of Costa Rica. He is currently enrolled for a PhD at the University of Granada in Spain. Alfonso is adjunct professor of pharmaceutical care and clinical pharmacy in the pharmacy faculty of the University of Costa Rica. He serves on the National Drug Information Center and is affiliated to the Pharmaceutical Research Institute at the University of Costa Rica. Alfonso, over to you.
Thank you, Sabiha, for your presentation, and thank you, FIP, for the invitation to this webinar. I am going to talk to you about what is the situation of antimicrobial drug resistance, immunizations, and community pharmacy services in Latin America region. Antimicrobial drug resistance is a public health problem that affects globally, and in Latin America region is not an exception. It affects community and hospital settings, and there are common pathogens that are increasing resistance right now. These problems affect a proper treatment of community and hospital acquired infection. And one of the problems is that there are no regional studies on antimicrobial use in hospitals and community. So there is a limited information available on prevalence. So it is important to advance current knowledge of prescription and consumption of antibiotics. Some important strategies like stewardship programs that are used to prevent antimicrobial drug resistance are relatively new in Latin America. Next slide, please. What happened with vaccination? According to Pan American Health Organization, the coverage rates of vaccination are lower than the region-wide rates of 95% vaccine coverage at the national level. There are many barriers that affect vaccination in Latin America. One of the most important is individual or group influence, but also allow socioeconomic group, less educated, age, contribute to low vaccine uptake. We need more data within target population, subgroups, countries, and vaccine type. And one important thing is the education and trust in healthcare professionals promote vaccine acceptance. And this is an opportunity to the pharmacists and to the community pharmacists to promote vaccination in the region. Next slide, please. The pharmacist has an important role to control and prevention of infectious disease in health systems, and they have many responsibilities. They promote optimal use of antimicrobial agents. They bring education and information, and in this case, the National Drug Information Center, CIMED, of University of Costa Rica, promote education and information to families, patients, communities, and healthcare professionals. Other important strategies and responsibilities of the pharmacist in control and prevention of infectious disease is to reduce the transmission of infection. And in this case, it is important the development of immunization services, in particular the immunization services in community pharmacies. Next slide, please. In the region, in Latin America, community pharmacies has an opportunity to the development of immunization services. There are many cases in so many countries in the development of this immunization service in all region, America region. There are cases in Canada, United States, Argentina, Brazil, Chile, and Costa Rica. This immunization service have different characteristics and activities according to health system policy, federal, state, or local regulations. What are some of their activities? They encourage routine immunization, for example, influenza vaccine. They screen patients and identify those in need of immunization in patients. They dispense vaccines and administration of vaccines. For example, in Costa Rica, the community pharmacies administer influenza vaccine and some other vaccines. Other important activity is pharmacovigilance and education and information. In conclusion, community pharmacies have an opportunity to the development of immunization services. So it is very important that the pharmacists get involved in these activities to control and prevention of antimicrobial drug resistance. Thank you for your attention.
Thank you very much, Alfonso. That was an excellent overview of the vaccination status by pharmacists in the region of the Americas. As I mentioned earlier, we will allow each presenter to complete the presentation and we'll take a panel discussion at the end. Our second speaker is Manjari Garath, who is an principal of the PRIN-KM Kungnani Pharmacy Polytechnic near Mumbai. She is the Vice President of the Indian Pharmaceutical Association, or the IPA, and chairperson of the Community Pharmacy Division of IPA. She's also an EXCO member of the Southeast Asia Regional Pharmacy Forum of FIP an immediate past vice president of the community pharmacy section of FIP. She is the newly elected vice president of FIP. She received the fellowship of the IPA and several other awards from social and professional organizations in the country. She is the recipient of 2 global awards. The first is her nomination as a fellow of FIP in 2016, and the Ishidate Award of the Federation of Asian Pharmaceutical Associations in the year 2018 in recognition of her services to the pharmacy profession. Welcome, Manjari, and over to you.
Thank you, Sabiha. Thank you, FIP, for this opportunity to speak about the Indian perspective of how pharmacists can be vaccinators, or are they going to be vaccinators in India. When we look at India, as everyone knows, India is a big country and we have a huge population of 1.33 billion. So whenever the COVID vaccine comes, we are all waiting for that, I know, eagerly. So whenever the COVID vaccine comes, then its production, its delivery, its regulation, and giving the doses to the Indian population is going to be a huge challenge. One of the huge challenges would be the number of healthcare workers who can be engaged in the administration of this COVID vaccine. Right now, we have 20 healthcare workers for 10,000 people. I know this is below the WHO's minimum threshold of 22.8, but we are still better than before. And we earlier had 18 HCWs and now we are at 20. But the problem with Indian healthcare workers distribution is there is severe shortage and maldistribution within the health workforce. Rural areas with nearly 71% of India's population. As you know, more than 70% of India's population reside in the rural areas. But the healthcare workers available in the rural areas is only 36% of the total health workforce. And this is the maldistribution that we have. Now look at the pharmacies, the community pharmacies or the private pharmacies in India. We have 750,000 community pharmacies in India. So that is 0.75 million. It's a huge number. And fortunately enough, these community pharmacies are in every nook and corner of the country. So when we look at the maldistribution of the healthcare workers in the rural areas, but when we look at the community pharmacies, it's quite an encouraging picture that we have these private pharmacies in all corners of the country to serve the population. Can I have the next slide, please? Can I have the next slide, please? Thank you. India, what is the situation of antibiotic usage or antimicrobial usage in our country? India is among the countries with the highest bacterial disease burden. As you all know, we lead in tuberculosis, we have gastrointestinal infections, we have several other respiratory infections. So the antibiotic usage in the country is very high. We are one of the topmost consumer for the antibiotics. And there is rampant misuse, overuse, and underuse of antibiotics, or in general antimicrobials in the country. When I say misuse, overuse, and underuse, I refer to all the stakeholders involved. There has been self-medication by the consumers. There has been sale of prescription antibiotics. Antibiotics are prescription medicines in India. Sale of antibiotics without prescription. There has been irrational prescribing by the doctors. There are fixed dose combinations which are irrational. Many of them are irrational. So there has been misuse, overuse, and underuse from various stakeholders in the country. And that has given rise to AMR, the antimicrobial resistance, which is our major problem as is globally. Can I have the next slide? When we look at the India has the vaccination program, the National Immunization Schedule, and a vaccination program which is delivered free of charge through the public health facilities. The vaccination is given by doctors, nurses, and some other healthcare workers. For example, the healthcare workers who are the community healthcare workers, we call them ASHA workers. So they don't have any formal health education, but they are from the community, they are from the rural areas, and they are trained, and they are trained to administer the medicines as well as the vaccines. So even the ASHA workers, the community health workers, are involved in vaccination. But the pharmacists have never been roped in any immunization program. the experience so far the pharmacists have is only the participation in certain campaigns like Pulse Polio campaign. But pharmacists have never been the vaccinators or vaccine administrators in our country. In fact, pharmacists have never been part of any national health program for that matter, except the tuberculosis control program. We have the positive experience and the positive evidence of pharmacists working as DOT, the dot provider in area of tuberculosis. So going forward with this positive experience and evidence, going forward, we feel that, can I have the next slide? If the pharmacist can be engaged as for immunization, or as if the pharmacies can be developed as immunization center, as we had DOT centers. So there are many advantages. The pharmacies are located right in the community. They're open for long hours. I can tell you that the Indian pharmacies are open for 12 to 14 hours or even longer. And in general, the pharmacist and the patient share a trust relationship, friendly relationship. So these are the advantages that the pharmacist can, these are the advantages that pharmacists can be developed as an immunization center. But we had done the study 2 years back, and there were some barriers perceived. The trader image of our pharmacists. Pharmacists in India are still not considered as healthcare professional. They're more like a shopkeeper. So that trader image somewhere prohibits their role in public health. There is an excess workload by the pharmacist, and there is lack of policy whether the pharmacist should be involved in immunization, of course, and there is no training. So these were some of the barriers perceived in our studies. But now the COVID-19 pandemic had changed the situation. It had changed the perspective too. There has been, the pharmacies have demonstrated, the pharmacists have demonstrated their role in the health system. And there is realization by the public, there is realization by the stakeholders, and now we can say that there is a huge opportunity for the pharmacist in public health, especially when we talk of the vaccine administration, because there is shortage of healthcare workers in India. And if pharmacists can be involved, definitely we can increase the pool of human resources. Can we have the next slide? So the Indian Pharmaceutical Association and some other pharmacist organization took lead. We took the initiative, and we are pursuing the government. We have written the letters to the government regarding engaging or including the pharmacist in the immunization program to increase the pool of healthcare workers. Can I have the next slide? So the letters have gone, and we have been talking to the government on these issues, and I'm very glad to tell you. Can I have the next slide? The key opinion leaders, the public health specialists, the policy makers are now talking about, first time in the country, they're now talking about that the pharmacists can have this new role, and you can see the news media talking about it. And this is really a positive sign. It has never happened before, but now we are going forward with this thought, and the thought process has started. Can I have the next slide? And so, when we are talking of pharmacists as the vaccinators, we are inspired by the FIP's development goals. As you all know, FIP recently launched 21 development goals to support the transformation of pharmacy worldwide. And the goal 17, which focuses on antimicrobial stewardship. Taking inspiration from that, I see a way forward for us. And the goal, as the goal says, any new service has to be backed well by policy, training, and funding. So that's what we are now trying to organize, that there has to be a policy framework, has to be training, and we will be taking help of FIP and guidance of FIP in training our pharmacists when the decision comes through from the government. It is also important to impart the necessary knowledge and skills right from the early career, which we are lacking in our pharmacy education. So that also has to be in the pipeline, and so that we can have the new pharmacists coming out from the pharmacy schools who will be well equipped with the skills for immunization. So it is a very exciting time in India that we are talking about pharmacists as vaccinators, and maybe a new era is about to start for the pharmacy profession, and that may create the history. So thank you very much, and maybe I can have new story maybe after a few months when we talk about vaccination again, and maybe I can give you a positive news about the Indian pharmacists getting trained for the vaccination. Thank you.
Thank you, Manjari. Very valuable take-home messages, not only applicable to India, but also to other countries across the globe.
Thank
Our
you.
third speaker is Philip Howard, who is a consultant pharmacist in antimicrobials at the Leeds Teaching Hospital NHS Trust and honorary visiting professor at Leeds University. He is the president of the British Society for Antimicrobial Chemotherapy. He is a member of the Department of Health Antimicrobial Stewardship Group that produced the original Start Smart, Then Focus Antimicrobial Stewardship Guidelines and the Royal College of General Practitioners Target Guidance on Antimicrobial Stewardship in Primary Care. He is a member of the UK Department of Health Advisory Group on AMR and healthcare-associated infections and the NICE Common Infection Guidelines Group. He is a fellow of the Royal Pharmaceutical Society and has won the GHP GSK UK CPA Clinical Leadership Award, the UK CPA Lifetime Achievement Award, and was awarded the Order of the British Empire for services to healthcare. Over to you, Philip. Thank you.
Thanks very much. So I'm a hospital antimicrobial pharmacist in the north of England. And one of my other roles is as president of the British Society of Antimicrobial Chemotherapy that try to promote the responsible use of antibiotics globally. And we have a number of things promoting antimicrobial stewardship across the world. So I want to talk to you around vaccination as part of antimicrobial stewardship, and particularly look at some of the evidence bases behind it. And then I want to look at some of the work that we've been doing within the United Kingdom and some of the positive benefits that it's shown on there. So we're going to start off. So vaccines are one of the key strategies against antimicrobial resistance. And if you look at the diagram on the left-hand side, you'll see there are 10 strategies for tackling antimicrobial resistance. And vaccination and alternatives to antimicrobials are one of the keys in there. We do know from the evidence that antimicrobial resistance is directly related to antimicrobial consumption at an individual, local, national, or global level. And avoiding unnecessary antibiotic use is a key goal of antimicrobial stewardship. However, most of the time, immunization is often separate from most antimicrobial stewardship programs. The diagram on the right is from the WHO draft action framework on vaccination and antimicrobial resistance. And it describes the impact that vaccines have on an individual and society, and it's threefold really. So starting in the middle, they potentially decrease infections. They also prevent complications and secondary infections, and they safeguard communities through herd immunity. And overall, that can help by reducing resistant and susceptible bacteria from developing resistance. And hopefully it will further present further resistance sort of coming through. So we'll see less drug-resistant infections, and we'll have more effective antibiotics available to treat our existing infections. Next slide, please. So is there evidence that vaccination reduces antibiotic use? So a systematic review, a meta-analysis performed by Buckley et al. In 2019, which is in the Journal of Clinical Microbiology and Infection, which is a European journal, showed that the evidence wasn't particularly strong. That doesn't mean that vaccination doesn't reduce antibiotic use. What it means is that clinical trials have not been set up when they've introduced the vaccines to try and demonstrate it. So what did the review actually show? Well, it showed a number of things. It showed there was high certainty that influenza vaccine reduces days of antibiotic use in healthy adults and the rate of use. It probably reduces antibiotic use in children. There's moderate certainty for pneumococcal vaccines reducing antibiotic use in children aged 6 weeks to 6 years, and illness episodes in children require antibiotics aged 12 months to 35 months. And for the HIB vaccine, possibly reduces antibiotic prescriptions in children under 6 years old. Unfortunately, there was no data to support antibiotic use reduction with the measles vaccine, but you would expect to see less use in secondary complications. And it's probably quite early days yet, but we'd expect to see less use with rotavirus vaccine. But apart from that, there hasn't been the clinical trials set up to try and show that reduction in antibiotic use. All the evidence has come from epidemiological studies. Next slide. So if we look at the UK antimicrobial resistant national action plans and how vaccination fits in there, immunisation is a key strategy within the 20-year AMR ambition, which for us to have antimicrobial resistance contained and controlled by the year 2040. One of the key bits in there is about minimising infection, and that's going to be attained through optimising the use of effective vaccines. Our current National Action Plan from 2019 to 24 has the goal in there of development of and access to vaccines globally. So we don't want to just focus on increasing uptake of vaccination within the UK, but we also want to make sure through Gavi and others, we try and maximise the uptake of vaccination across the globe. Now, a survey that was done last year by the Royal Society of Public Health showed the most common barriers to getting vaccinated were the timing of appointments in 49%, the availability of appointments in 46%, and childcare duties in 29%. Next slide, please. So one of the advantages about pharmacies, we've heard in some of the other talks, is they have greater access to vaccination. Now, many of you have probably heard of NICE, the National Institute of Clinical Excellence, who produce many evidence-based clinical guidelines every year. Last year, they produced the National Guideline 103, and it had recommendations to increase influenza vaccination uptake. They requested a multi-component approach, so flu vaccination providers should all work together. They should raise awareness in health and social care staff, and so it's now been included in part of everybody's continuing personal development. We should be offering vaccination at every opportunity. So in community pharmacy, this is when patients come and collect their prescriptions, and face-to-face is actually better than trying to message patients. And pharmacies are open at evenings and weekends that further provide opportunities. In the UK, there are actually vouchers made available for eligible staff to get their vaccines. So doctors or nurses or pharmacists at hospitals who can't get vaccinated could take a voucher to a pharmacy and get vaccinated. Within some of the hospitals, mine particularly, as part of our medicines reconciliation process on admission, we actually check the vaccination status of the patients that come in. Those patients who've not had their influenza vaccine are spoken to, and they're offered their vaccine when they are in hospital. And if they do accept it, then we inform their GP. There's also recommendations at special hospital clinics, such as cystic fibrosis, transplantation, HIV, where lots of pharmacists are involved, offer influenza and other vaccines at the time. NICE also recommend increasing the uptake amongst eligible groups and carers in primary care and hospital. And so one of the things that's changed now is really try and make sure we get as many people offered their vaccines at every opportunity. And then finally, audit and feedback. So there's work that's ongoing about the uptake within the various groups, and also which groups have declined to have their influenza vaccine. And this is open data, so everybody can see how they're doing. Next slide, please. So in the UK is made up of 4 countries. Wales was the first country to get pharmacists to start doing vaccination, and that came in 2013-2014 winter season. The upright bars are light blue, are the total number of vaccinations in under 65s. The brown bar is vaccinations in those 65 and over, and the dark blue is those total vaccinations of all group. And you can see there's been a general increase over the years as we move along to the 2018 season of the total number of vaccinations that have been given. Now, the green lines are the percentage of the total that community pharmacists have actually given in Wales. And you can see since they started in 2013-14, they've slowly had an increase in not only the total amount of influenza vaccines that are given, but actually in the under 65 at-risk groups have grown higher than the over 65s. And these were the groups that we'd actually struggled to vaccinate within the United Kingdom. So I think this is a good message out there about the really good role that community pharmacy and improved access can target and successfully immunize those hard to reach sort of groups. And the study, which was published last year, showed there was a strong positive correlation between the increasing community pharmacy vaccines and the total number of vaccination numbers. Though unfortunately, we didn't see an increase in the absolute number of patients who were vaccinated. Thank you very much.
Thank you very much, Philip. Some very interesting food for thought. We've saved the best for last. Our final speaker is Professor Deborah Goff, who is the Global Antibiotic Stewardship Advocate, Infectious Disease Specialist Pharmacist, and founding member of the Antimicrobial Stewardship Program at The Ohio State University, Wexner Medical Center, and College of Pharmacy in Columbus, Ohio. Professor Goff received her Bachelor of Pharmacy and Doctor of Pharmacy degrees from the University of Illinois at Chicago, where she also completed her residency. Professor Goff founded the OSU South Africa Train the Trainer Antibiotic Stewardship Pharmacist Mentoring Program in 2012. She received the 2019 OSU Distinguished International Outreach and Engagement Award for this work in South Africa. Professor Goff is one of the 25 global experts selected by the World Health Organization to implement stewardship programs in low and middle income countries in 2020. She uses Twitter at IDPharmD to increase global engagement, education, and awareness on antibiotic resistance. Over to you, Professor Goff.
Thank you, Sabia. And okay, it says the host has to allow me to share my video. All right. Well, thank you for that introduction. It was fascinating to listen to the other speakers and the amazing work that's being done around the world. I am going to focus on vaccination of influenza and pneumococcal vaccine, and then finish up with COVID vaccines. So let me just see if I can get this video to, oh well. All right, so if we start with vaccination of influenza, it plays a key role in the fight against antimicrobial resistance by decreasing viral infections, which decrease antibiotic prescriptions. According to the United States CDC data, influenza vaccination averted roughly 6.2 million cases and 3.2 million influenza-related medical visits during the 2017-2018 season. In our 2018-2019 flu season, Pharmacist vaccinated 1/3 of all adults in the United States. So that is a really significant contribution to the healthcare in our country. Next slide. The flu vaccine and antibiotic use in the United States, how are they related? So for the 2018-19 season, influenza vaccination coverage in the United States was 62% amongst children and 68% amongst the elderly, defined as greater than 65 years of age. But these two groups are also the highest users of outpatient oral antibiotic prescribing. So it's really important to increase their vaccination rate. And just a 10% increase in vaccine coverage in the pediatric population was associated with a 6% reduction in antibiotic prescribing rates. That's a huge return on investment. So any efforts to increase vaccination really pays off quite highly. Next slide. When we look at invasive pneumococcal disease, it was game-changing with the introduction of the conjugate vaccine in 2000. When we look at this bar graph, you can see where the arrows show the introduction of the 7-valent serotype for pneumococcal disease. The incidence declined by 45%. So it protected nearly 96% of healthy children against a very deadly invasive pneumococcal disease. And then in 2010, the second arrow there shows the introduction of the 13-valent serotype vaccine to further cover additional penicillin-resistant strains. Next slide. So the reduction of antimicrobial resistant strep pneumoniae after vaccine has really been a game-changing event. So when you look at this bar graph of the reduction of antimicrobial resistance after the broad rollout in our country of the 7-valent serotype vaccine on penicillin-resistant strep pneumonia strains, you could see after the introduction, it had a dramatic decrease in the prevalence of the disease, but we started to see the emergence of non-susceptible invasive pneumococcal disease due to the non-vaccine serotype, the 19A. And therefore, that led to the introduction of the 13-valent serotype vaccine 3 years later, and saw an additional decline by 97% in children under 5 years of age and in adults. Next slide. So how do we bring antibiotic stewardship, pharmacist, vaccination, and antimicrobial resistance all together? Well, in the United States, 90% of our population lives within 2 miles of a pharmacy. I love Manjuri's description of the role of pharmacies in India. Although there's a profound shortage of healthcare providers, she described how common it is to have pharmacies, community pharmacies, accessible to the majority of population in the rural areas. So the same is here. Although we have more healthcare providers, there are many rural areas that have healthcare provider shortages of physicians and nurses, but the community pharmacy is prevalent everywhere. Each year, an average of 90,000 Americans die of vaccine-preventable infections such as influenza and pneumococcal disease. But we have a major change in our country. As of August 20th of this year, U.S. Pharmacist achieved a major win when our Health and Human Services authorized all pharmacists and pharmacy technicians to provide CDC-recommended and FDA-approved vaccines to children and adults during COVID-19. So when the COVID-19 vaccine becomes available, we will now be able to be the healthcare provider to administer that. And that is such an important role. Vaccines, we know through the data we have just shown you, decrease antibiotic prescriptions, which then decreases antibiotic resistance. It decreases antiviral prescriptions, and most importantly, the whole goal is to prevent disease. And I think COVID, as Manjuri said, is creating new opportunities for our profession. We are in the most exciting era to think of the expanded role of pharmacist because of COVID. That has become a very positive outcome of the COVID pandemic. And to see countries like India looking now to us as a healthcare provider to help prevent the spread of COVID, and that will further allow pharmacists to allow us to provide these vaccines in many of the other countries that currently do not allow pharmacists to provide vaccines. So I think this is an amazing opportunity for our profession, and we need to seize the moment. Thank you for your time.
Thank you very much, Debbie, for that very interesting presentation. I'm going to, a number of you have already answered the questions that have come up on the chat and the Q&A, so I thank you very much for that. But I have a number of questions that I would like to pose to the panel as a whole from the chat that I think requires discussion in person. And then I will, in the last few minutes, highlight the take-home messages and the next event. So just to start up with, the first question I have is, in most of the countries, pharmacists are not authorized to administer vaccines. In these places, how can pharmacists help in vaccination? So I open that up to anybody that wishes to speak. So who would like to take that question?
Yeah, so it's Philip. So I'll tell you a bit of history from the UK before pharmacists were allowed to administer flu vaccines. What we found was that through private arrangements that allowed people to administer vaccines, that patients would actually come in and request vaccines. When pharmacists started to have the authority to start vaccinating patients aged 65 and over, but not some of the younger groups, there were a lot of people, such as myself, so I've got asthma. Instead of actually going to my GP and having to make an appointment and take time out of my day, there were lots of people who reported they were willing to pay the pharmacist a fee to actually get their sort of flu vaccine in hours that met their hours of work. So I think in those people who need to go to work and find it very difficult to get an appointment with their family doctor, I think there's real opportunities for the community pharmacist if there isn't a contract in place to offer vaccines.
Thank you, Philip. I'm going to, because I have a number of questions, I'm going to ask each of them, and then we can double back to those that we want to add more to. So the next question is a very interesting one, and it says, what are some of the key assessment areas, or I read them as, what are some of the key criteria that must be considered before embarking on the journey to advocating for pharmacists becoming involved in vaccination programs? So basically, I suppose this means what must be put into place before pharmacists can be authorized to undertake vaccination. Who would like to take that?
Thea, I'll answer that question.
Thank you, Debbie.
So, thank you. You have to have training programs. So when the United States introduced and the approval for pharmacists to become vaccinators, we have a training program. Obviously, someone has to allow and train the pharmacists that are going to provide this. So there are many programs that are available online, but that clearly is the first step that has to be taken.
Yes, Deborah.
Sabiha?
Yes, Sabiha. Yeah. So what I would like to say, in countries like India or in Southeast Asian region, where the pharmacist's role is not yet well established as a healthcare provider, when we go for such type of endeavor, a new role, a new service, I think it is very important that we set out the inclusion criteria for the pharmacists, because many of the pharmacists may not have the registered pharmacist services in the country or in the region. So that would be one of the first criteria, that there is a pharmacist present all the time in the pharmacy, and there is a willingness, there is an infrastructure, and also the track history of the pharmacy, the pharmacist qualification and the training done so far. So when we did the DOTS TB program in Indian pharmacies, we had decided such inclusion criteria, and accordingly the selection of the pharmacists who are willing was done. And then we went on for the training, as Deborah said, that the training has to be developed. and then the pharmacists were trained. So I think there is a huge lot of work we will have to do when we decide the key assessment areas and the selection of pharmacies.
Excellent. Thank you, Manjuri. I've got two questions that I'd like to ask. The first is, how do we increase the trust in our healthcare professionals to improve vaccine access? And the second question is, how do we ensure equity of access to existing vaccines and to the new vaccines? So who'd like to take that, please? Go ahead, Debbie, please.
Thank you. You know, trust is such an important component of doing stewardship. I always teach they have to know and trust the steward before they're going to follow your advice. And that's really a concept called Handshake Stewardship. Introduce yourself to the healthcare providers that you think right now don't trust you. And it's really because they don't know you. And once you know a person and realize they have knowledge and they are there to help patients, that trust is earned. And it's not as hard as we think. It's really just about introducing yourself and providing and letting that other healthcare provider know that you have a service to help patients. And that's your goal, is to help a patient. And then that trust can be developed.
Excellent. Would somebody like to take the question on equity of access? So there was a point made that the vaccines, the flu vaccines for patients 65 years and older are not readily available. And then as the COVID vaccine becomes available, we are going to have issues around equity of access, making sure that the people that need it most get the vaccine. So would anybody like to speak to the access aspects?
Yeah, I'll answer this one. So I think the really important thing here is probably a standardized approach at national level. It needs the governments to decide what are the priority groups who need the COVID vaccination. It needs all of the professions to work together to make sure there is good communication from the government downwards. But also, when patients are vaccinated, there are systems in place within that country to record on the patient's primary record that they've received that COVID vaccine. It's really important that pharmacy play a central part in this, especially in those countries who have already got pharmacists as vaccinators. In countries where that isn't the case, I think there is a real opportunity where we're going to have to probably do the largest vaccination program the world has ever seen in a short period of time. There needs to be that expertise, and I think people will start accessing pharmacists as equal partners to try and do it. In terms of trust, I think Debbie's right. Certainly all of the surveys that I've seen in the UK is pharmacists are the most trustworthy profession out of any of the professions. And I've had 3 people already this year who've had their flu vaccine done by a community pharmacist and said they never felt a thing, and that's the first time ever. And that doesn't speak any higher than that, in my opinion.
Thank you very much, Philip. So all the educators on the panel, and perhaps Alfonso, you'd like to take this question. Does our existing pharmacy curricula cover vaccination adequately? So do we teach our pharmacy students enough about vaccination for them to take on the role?
Thank you for your question. It is a very important question. It depends on local regulation, but the important thing is with the pharmacist curriculum that we need to introduce this topic. We need to teach a pharmacist student that they can get involved in this kind of activities. The most simple activity that they can involve make the difference to the health system. So if in the country we only can do information, so do information. But if you can administer vaccines in your family, in your pharmacy, that's great. So it depends on the local regulations and the particular way of different countries. But it is important to introduce this topic in the curriculum.
Thank you very much. So I'm going to do a speed round of one take-home message per panelist. And let me start with Debbie.
Thank you, Sabia. I think the message is our profession has a golden opportunity to expand our role and really be an integral part of healthcare. So in the United States, we have that, and we've worked hard over the years. I think every pharmacist needs to step up now, and COVID has provided us the opportunity. Please take advantage of it.
Thank you. Philip?
Yes, for me, pharmacy is now being seen as a partner in our battle against antimicrobial resistance. There are lots of opportunities for pharmacists to offer advice and avoid the need for antibiotics, whether that's in symptomatic treatment of minor infections or the immunization programs through pharmacies. I think this is a major step forward, and I look forward to seeing pharmacy having a huge involvement in vaccinating the world against COVID.
Thank you very much. Manjari?
Yes, in line with what my other colleagues have said, the COVID-19 pandemic has demonstrated the value of the pharmacy profession in the health system, and it has provided a huge opportunity for all of us. The FIP's development goals are really inspiring, and we can build on those development goals to support the transformation of pharmacy profession in our countries.
Thank you very much. And Alfonso, the last word to you.
Sorry?
You want take-home message from you?
Yes, the last message are going to be, thank you for the invitation. Thank you for this activity. And it is important that the pharmacists get involved in this kind of activities. It is important the information, education, and to help to prevent the antimicrobial drug resistance.
Thank you very much. Farah, if I could just have the last two slides, please. Thank you very much, Alfonso. So take-home messages. Vaccination is key to strategic objective 3 of the Global Action Plan on antimicrobial resistance. Vaccination reduces the incidence of infections and the need for antimicrobials, and a reduction in use therefore lessens the selection pressure for the escalation of AMR. The role of pharmacists in vaccination is determined by the health system's policy and federal, state, or local regulations, and may include one or more of encouraging routine immunization through education and advocacy, screening patients and identifying those in need of immunization, dispensing and administering vaccines, and undertaking pharmacovigilance. Next slide, please. COVID has entrenched pharmacists as frontline public health professionals in preventing infection, and this should really be leveraged to include pharmacists as vaccinators. The accessibility, availability, and equity of access to vaccines will be substantially improved by community pharmacist vaccinators. Any amendment, however, to the scope of practice of the pharmacist should be accompanied by the necessary knowledge and skills, which should be integrated into pharmacy education. And any new pharmacy-led vaccination service must be supported by policy, training, and reimbursement. So pharmacy vaccinators ushers in a new era for pharmacy. That concludes this session. Our next session, episode 6, is the role of pharmacist vaccinators in improving access to and equity in healthcare outcomes. This is the FIP Development Goal 10, Equity and Equality, and FIP Development Goal 18, Access to Medicines and Services. It will be moderated by Catherine Duggan, the CEO of FIP, and the speakers will be Jane Barrett and Alexandra Ruth. And we look forward to your participation on that session on November the 17th at 2 p.m. Central European Time. So with that, I would like to thank, first of all of the panelists. Thank you for your incisive contributions and the excellent discussions that we had in the panel discussion. We really appreciate your inputs. Thank you for all of the attendees. I know we haven't managed to answer every single one of your questions, but we certainly appreciate all that you've done, and whatever we haven't answered live or online, we will make sure that we try to attempt to answer that going forward. So the recording of this episode will be available on the FIP website, and we welcome your feedback to this webinar. Thank you very, very much for participating, and have a great afternoon, evening, or night. Thank you very much, everyone. Bye-bye.